Okay, good afternoon, good morning, good evening for participants. I hope you're there because I can't actually see you from my screen. So I hope you are all here and seated and ready to learn about pollution and health and its impacts on climate change and the Sustainable Development Goals. And the name of our session today is indeed Reducing Pollution and Its Impacts on Health and Climate Change, a vital part of the G20's Safeguarding the Planet agenda. My name is Rachel Kupka. I am the Acting Executive Director of the Global Alliance on Health and Pollution, and I am your moderator today. We have on our panel some very esteemed and wonderful experts, many of whom I have had the pleasure of working with for several years. We have Dr. Jack Caravanos, Clinical Professor of Environmental Public Health Sciences at New York University. He's also the Director of Research at the nonprofit organization Pure Earth. We have Richard Fuller, who is the founder and president of Pure Earth and chair of the board of the Global Alliance on Health and Pollution. We have Pratana Bora, India director for the nonprofit organization Clean Air Asia. We have Dr. Lillian Cora. She's the senior environmental health expert at and fellow Collegium Ramazzini, Director of Medical Specialization on Environmental Health at the University of Buenos Aires. We have Dr. Ibtihal Fadhil. She is the founder and chairperson of the Eastern Mediterranean Non-Communicable Disease Alliance. And last but not least, we have Raymond Ryoka, who's advocacy officer at Reproductive Health Uganda and also on the board of the Global Alliance on Health and Pollution. We're delighted to have you all here today and look forward to a compelling and interesting discussion. I really would like to start very quickly by giving you a brief overview of the major data and findings that we know about pollution and its impact on health. According to the Lancet Commission on Pollution and Health, pollution, which is basically everything in the environment that humans put into it that come back and harm humans. So pollution kills about 9 million people a year. This is about 16% of all deaths worldwide, and it's one of the largest, it is the largest environmental cause of premature death on the planet. When we think about who pollution impacts the worst, it's the poor countries. It's low and middle income countries who are hit the hardest. In fact, 92% of premature deaths from pollution are impacting low and middle income countries. Ambient air pollution or outdoor air pollution is responsible for almost half of all those deaths. That's 4.2 million premature deaths each year. Lead pollution is responsible for almost 1 million premature deaths each year. And the interesting thing about air pollution and climate change is that they're quite linked. The burning of fossil fuels and biomass is the world's largest source of both carbon dioxide and disease-causing particulate emissions, so particulate matter 2.5 in particular. As we look at which countries are most impacted, it is actually a little bit surprising that 6 of the G20 countries actually rank in the top 10 countries with the most pollution-related deaths each year. And those are India, China, Indonesia, the United States of America, Russia, and Brazil. Pollution doesn't just cause tremendous impact on human health. It also costs countries up to 2% of their gross domestic product. Air pollution costing 1%, lead pollution up to 4% in Africa and 2% in Asia. Some countries' economic losses from air pollution and lead pollution alone exceed the development aid to that country. So the scope is quite large. So now I really would like to hear from our panelists today and bring this issue home. And why should we care? And why should we want to address this issue? And so I would like to turn it over to Jack Caravanos to speak to us a little bit about what are the impacts of pollution on human health? Like what is it actually, what does it do to the human body? And specifically air pollution and lead pollution. Over to you, Jack.
Thank you very much, Rachel, and thank you, C20 organizers, for this opportunity. So I will cover two of the sort of most important environmental contaminants and ones that can be controlled, of course, and that is air pollution, and we'll go over lead. Air pollution, as you heard from Rachel, has serious impacts, especially to respiratory health. And we all see this in our day-to-day lives, especially in low and middle income countries where we have indoor burning using charcoal and wood and other sort of inferior organic-based fuels. And these cause very, very small particles. Next slide. And these particles, called PM 2.5, particulate matter 2.5 microns of size, are extremely small and penetrate to the alveoli of the lung. But what's also important is not just the organic nature of the particle, but also what deposits outside. So as you burn something, you're actually producing polycyclic aromatic hydrocarbons, aldehydes, a host of chemicals that coat the particle. So you have a double effect of the particle carrying toxins deep into the lung. So it's a serious issue, and the IARC, the International Agency for Research on Cancer, in 2013 has declared PM 2.5 from an organic source a carcinogen. So we see these very serious effects coming up. The particulates, as I say, enter the body and go deposit throughout the body. Particles that are large can get easily expelled in the nasal passages, but as you know, especially now with COVID, particles can easily be deposited very deep into the lung. And that's very serious because what we have is the inability to clear the lung of these particles. So that produces a host of symptoms. And specifically, we have these particles, depending on what they are and how small and what is coated over them, producing all sorts of damage. We have immune system damage, heart stress, lung, COPD, chronic obstructive lung disease. And actually, some of these agents that are coating these particles are neurotoxins. So you have I hate to say, a wonderful way of these particles entering the body. Now, with respect to COVID, which we're very concerned with these days, and it's not over, this is an exacerbating synergistic effect because we have stress on the body caused by the air pollution, which then puts the individual at increased risk of a host of other diseases. So you could see this as synergistically affecting each other. And when we look at what diseases associated with air pollution, which is very well studied, very well quantified, and Rachel read off some of the numbers of the number of people affected, it really does affect both the three major causes of death, which is heart disease, lung, and cancer. So all of these are found in PM 2.5 in various amounts, depending on the fuels and location. So it is what may seem like an innocuous smoke leaving a fire or an oven is actually dangerous material. The second very important environmental contaminant that this panel will address, and that we'll go over some interventions and strategies, global strategies on controlling this, is of course lead. Lead is an inorganic element. It cannot be destroyed, unlike aldehydes and alcohols that can be broken down into smaller things. The lead we have mined and released into the environment stays there. And it could be a very fine particle. So these children playing on a lead contaminated mound of soil that came from mining can easily mobilize this material and inhale it as 2.5. And of course, this is the added danger of lead. The lead, by the way, is the numbers that are being, that children are seeing today is tremendous. We've done studies and it's been quantified about 800 million children have elevated blood lead. There was a time that we thought there was a tolerable amount of lead that the body can handle, but now the consensus in the scientific community is that no amount of lead is without impact. So even the smallest amounts. So we're seeing just about 1/3 of all children globally have elevated blood leads above the standards of 5. With regard to damage, what is insidious about lead and horrible is that it affects the young and it affects the developing brain, and the results are irreversible. So what you have is a situation where children are most at risk, and of course, children playing on contaminated soil are very, very easily exposed, and the damage to them is very serious because the brain is developing and it's irreversible. So whether it's permanent IQ loss, or whether it's increased disability impairment or cognitive impairment, or even violence, lead's been linked to exacerbated violence, we see some horrible events that, again, cannot be easily remedied. So this is why we really do want to control it. And the sources of lead, when you look at where does this material come from, let me say that it is a very valuable commodity. I always tell people, we really will not eliminate lead from the commercial industry because it is a very valuable commodity, but we can control it properly. Some of the uses that seem to dominate, believe it or not, spices, lead chromate, the yellow and reds, lead carbonate, the white pure powder, are very often used as colorants. Also, lead is a heavy material, so it adds weight to spices. So what you have is a variety of inputs, whether it's food, water, air, and unfortunately, on the right there, you see cookware, where lead is used to reduce the melting point of silica and produces that nice glaze on a pottery. So we have many countries that, of course, use clay to make pottery, and you need a glaze on that to prevent permeability. So, and lastly, batteries. Our organization, NYU, and many of us in the environmental remediation world are very concerned about what is the safe, proper way of handling batteries. Batteries have 10 kilograms of lead, so it's a very valuable commodity. They're very highly recycled. So we want to really control these, and we'll get it over that. We'll talk about some of this in the latter part of this presentation. So that is it with these two contaminants. There's wonderful material on the web, but now let's talk about the inequities that are exacerbated by pollution exposure and exactly who's at risk. Thank you very much, Rachel.
Thank you, Jack. And participants, please put any questions in the chat box, and we'll do our best to address them at the end of the session. Great. So over to you, Pradana, to talk to us a little bit about some inequities that we're seeing come up from exposures to pollution.
Thank you. Thank you, Rachel, for inviting me to this panel. And thank you, Jack, for such a fantastic introduction. So I'm going to speak about inequity from the perspective of Asian cities. Clean Air Asia works in about 1,000 Asian cities in terms of advancing better air quality. So I would like to speak about it from the perspective of Asian cities. So if you look at this first slide, this is a result of a survey that we did in 465 Asian cities, out of which 406 were developing Asian cities and 32 were developed Asian cities. So if you look at it, 99% of cities in Asia show unhealthy air quality levels as per the WHO air quality guidelines. So the starting point is that it's not one or two cities, but it's actually 99% if you look at a large number as large a number as 465 cities. And only 35% of these cities actually meet the WHO interim targets, which is much higher than the WHO guidelines. Now, the question is why? The question is because all these cities are at a stage of development where they're rapidly developing unplanned development, unplanned infrastructure, huge vehicular emissions from expanding traffic, and a lot of demand for energy. So how do we address inequity in this context? I mean, it is actually about looking at it from the perspective of energy, transport, and also the kind of urban development and planning that is happening. And this is where probably the starting point starts, because the whole issue of inequity comes in only at a much later stage when we start talking about the health impacts, but actually we need to address it right at the planning stage. And this is what Clean Air Asia is trying to do in terms of clean air action planning, integrating inequity in terms of vulnerable communities and bringing it right in the phase when you're addressing a city's development process. The second perspective that I would like to bring into this forum is the whole issue of the relationship between air quality inequity, equity, and SDGs. Now, if you look at the issue of inequity, equity, there are three vulnerability dimensions. The first is exposure, so where you are vis-a-vis a pollution source. The second is sensitivity, which is what you are in terms of an age bracket or in terms of sensitivity in terms of your health, in the level of, in case you are a vulnerable community in terms of your, you have of diseases that you have. And the third is, of course, adaptive capacity, which is actually a positive aspect in terms of how you adapt to an exposure. So if you have the means, you can adapt to it, right? So basically, if you look at air pollution, there is transport, waste, there is industry and energy, and these are primarily looked at as sources, while you know that air pollution leads to ecosystem damage and health. And what we've tried to do is map the vulnerability dimensions and bring in equity into major issues, like when we deal with clean air action planning within the transport sector or within the waste sector, energy industry, and all the other areas that are mentioned here. So just to give you one example in the shortage, because of the shortage of time, basically transport, when you look at transport, you have to look at it from the perspective of exposure, because there are people who live near high transport zones. There are younger children who are much largely impacted by transport emissions. So the mapping has been done in such a way that, you look at the three vulnerability dimensions. The third area that we have tried to link this is to SDGs, because we feel that if you link it to the SDGs, the indicators do look at how you address inequity, but it's just a question of how you highlight air pollution vis-a-vis the SDGs. In the absence of an individual, SDG for air pollution, I think it's very important that we have this intersectoral mapping whenever we address air pollution.
Excellent. Thank you, Pradana. I would like to ask Dr. Ibtihal to speak about inequities related to non-communicable diseases.
Hi, thank you very much. Thank you for the C20 Secretariat for inviting us. And thank you, Rachel, for engaging us with this very important topics. As far as from the NCD perspective, we all know that NCD community is becoming more engaged in, as air pollution has been recognized as one of the main risk factors for NCD in the NCD 5x5 agenda. It's well documented that ambient air pollution is a major cause for non-communicable disease, as we can see in the slide. And NCD death and disability globally, it is estimated that 4.2 million premature deaths are linked to air pollution. 91% of the population are living in unclear or contaminated air pollution situation. 3.8 million deaths linked to household air pollution. Air pollution linked to many of NCD deaths, and mainly we are talking about here heart disease. So we can see 24% of all deaths from stroke caused by air pollution, 25% of death from ischemic heart disease and disease related to and linked to air pollution, 43% of death from chronic obstructive pulmonary diseases related to air pollution, and air pollution are well linked by the evidence to lung cancer and acute respiratory disease among children. Evidence also shows a quite strong linkage between air pollution and some neurological disorders such as dementia and potential linkage with diabetes and mental health. The scientific community also have shown at the same time there are currently many existing policy in place and solution for clean air, which bring a quick and health benefit for the population, even within a few days. And the example we are referring here, like the traffic reduction measures, or switching to a clean coke stove, etc. On the slide, it's the issue of the cost of and disparity related to a premature death from non-communicable disease and the economic cost of the society. It has been estimated, and we can see clearly here from the map, the economic cost is huge, and it has been estimated 6% or generally 6% of the global income. My second message from this slide that the air pollution is a major concern for the development community. Because air pollution widened the health gaps, both between country and even within the country. For country is affected by air pollution, every country affected by air pollution, we know. But the burden is most heavily borne by low and middle income country, where the population are most exposed and the health system is already struggled and less equipped to address the burden of non-communicable disease. We have seen that the 95% of adults and children affected by pollution-related illnesses live in low and middle income country. My message is number 3, despite the disparity within each country, the health burden and cost of air pollution affect heavily the poorest in the society. And these poorest, especially the people who are living in a very heavily populated area and living very close to industry and area of contamination like fossil fuels and transport and so on. On a positive term, it is well noted that the air pollution level have decreased in the past decades, have decreased in most high income country in Europe as well as in America because of well implemented clean air policies, which we will be, I think we will go over in the next slide. I will stop here and we will be talking about more solution in the coming slide. Thank you.
Thank you, Dr. Jahal. Dr. Cora, it would be wonderful if you could tell us how pollution is impacting countries in Latin America.
Yes, thank you for inviting me to give the perspective from Latin America. The main sources of air pollution, also we share globally, is from pollution is air pollution, pesticides, heavy metals, water, and food pollution in Latin America. Countries in Latin America are highly urbanized, over 85%, and peri-urban areas are the most populated, and with the worst living condition, with high rates of air, soil, and lack of access to drinking water. In the rural areas, we have intensive and extensive use of pesticides, which residues are present in food, land, and also water. We have a very high rate of inequality. Almost 60% of children are poor. 1/3 are in the poorest 20% of households. And we have high rates of informal sector participation that accounts for 34% of the GDP in the region, and 53% of total employment is informal, ranging from 23% in Uruguay to about 80% in Bolivia. Of course, the poor are the most vulnerable to pollution. They are marginalized and excluded. They are suffering an erosion of the capacity and protection. They have lack of access to adequate housing, drinking water, and they have reduced perspective of a better future. Of course, they have also reduced access to health care, and children has no voice and are the most excluded. The indigenous descendants are the more vulnerable. They are excluded from the decision-making process, and their way of life is closely linked to ecosystem equilibrium, which is endangered by mining, deforestation, and pollution. The inequities are now exacerbated by the COVID-19 pandemic. The pre-existing disease burden from pollution made population more vulnerable and susceptible to the consequences of COVID-19, in particularly in children, pregnant women, elderly, sick, young people of reproductive age. The increased burden of the whole healthcare system is eroding its capacity. The long-term effects on equality in the region erosion the human capital, particularly of the poor. The negative impacts on in utero and early childhood nutrition and exposure to pollution is an important barrier to progress on the Sustainable Development Goals, where quality of life and health for children under 5 are still of great concern. The environmental burden of pollution is avoidable, and the inaction is not justifiable. Thank you.
Thank you, Dr. Cora. Raymond, what are you seeing in Africa and in Uganda?
Thank you very much. And thank you, the C20, for giving us a platform and the GAP for thinking about Africa, who is the source of the impact of pollution, because we are one of the least developed countries, and the impact of pollution is evident. In relation to the Africa, the ambient air pollution in sub-Saharan Africa is 10 to 20 times higher than the WHO standard because of the impact of the pollution. And definitely there's a need to focus on Africa addressing pollution. As Jack mentioned and Lillian a couple seconds ago, the airborne contaminants from cars, factories, and wood fires, they cause fatal heart attacks and strokes, lung cancer deaths, chronic obstructive pulmonary diseases. All these are a result of the contaminants from cars and factories and wood fires. Of course, a recent article found out that to 40% of infant deaths in sub-Saharan Africa were attributed to post-birth PM 2.5 exposure. And this is according to FTNL 2018. So the impact of pollution is evident in Africa, and definitely in sub-Saharan Africa is the more evident because of the pollution. And the exposure to air pollution is also linked to premature births and low birth weight. And this is evident in Africa, being one of these countries, and the impact is huge in Africa, and the focus should be really in addressing pollution in Africa as part of addressing the impact of pollution, especially to the health of the communities, children, and mothers. Thank you.
Thank you, Raymond. Now, Richard, could you tell us what some key policy recommendations and practical solutions to pollution might be?
Thank you, Rachel, and thank you for inviting us here, C20 organizers. What's good to know about pollution is that many aspects of the pollution spectrum are quite solvable with nominal investment and significant return on that investment. Two statistics here from good peer-reviewed publications. $1 spent in the US on air quality controls has produced $30 in net economic benefits. And the numbers are even higher with respect to lead. When you mitigate lead in paint, every dollar spent can produce up to $200 worth of economic return. So these are very good things to hear at a country level. But you want to really understand what does need to happen in terms of pollution management. And the first thing one needs to do is to understand exactly what are the main issues related to pollution in your country, and then look to see what are the practical solutions that need to happen. And there are a range of different issues that can be done. There's obviously a regulatory issue that can help in certain circumstances. For example, for large industry or for controls on auto emissions. There are also economic mechanisms that can be implemented that can move industry to non-polluting kinds of sources. And these do make changes based on changes in economic policy and can be very, very effective and powerful. These processes and ideas have been very well implemented with successes in many parts of the world. So there are examples of successes, more important examples of failures specific to different pollution types to be found across the globe. Of course, when we're worried about climate, as we all are, the key and core main strategy to reduce PM2.5 and carbon is to mitigate the use of coal. Coal is a particularly pernicious contributor to CO2. It's also usually one of the key sources of particulates in a city's burden of disease from pollution. And shuttering especially old and inefficient coal-fired power plants can make an enormous difference to public health and, of course, assist us in meeting our carbon obligations. Lead, perhaps much less known than PM2.5 and air pollution, but really in many ways, even worse than air pollution. Lead pollution is worrisome because lead causes brain damage in babies. And when lead is ingested, when babies are either in utero or in the first year of life, it stops the development of the frontal cortex especially. That part of the brain that's responsible for intelligence and decision-making. What lead does is while the brain is developing and making connections, is it inhibits those connections from happening. And animal studies show that even small amounts of lead reduce the number of connections per neuron from, in a normal brain, from about 12 to 14 connections per neuron to, in a lead-contaminated brain, 6 or 7 connections per neuron. So this kind of makes sense then that lead reduces intelligence as a result. And once you've reduced intelligence in a community, then it's also obvious that that community has a reduced capacity for economic growth. They're not as smart as they should be. There's not as many entrepreneurs as there should be. And change and economic growth is very difficult. So lead is really a pernicious problem that we ought to bring to public attention much better and really deal with it. And there are very pragmatic solutions for lead as well. The first thing one does when you're worried about lead in a particular country is you try to work out where it is. That means setting up a simple monitoring program. Put some simple pieces of equipment, especially in maternity hospitals, and try to understand where the kids are being poisoned. And then work out where the lead's coming from, because there are multiple sources of lead out there. And then once you know where the lead's coming from, then you can implement solutions to reduce those exposures. And they're very well known. Again, I don't think we're going to go through some of the specifics of lead exposure, but you know, of course, from Dr. Karavanos, spices and foodstuffs are particularly aggressive in Central Asia, in Middle East and North Africa, anywhere where there's high spice usage, South Asia as well. Many times spices and other foodstuffs have lead added to make them look brighter. As well, lead is to be found wherever they're doing improper battery recycling. And that's common in all low and middle income countries. Strategies for dealing with this are kind of self-evident, but are directed around, again, the carrot and the stick. Economic incentives to reduce those exposures, and then regulatory incentives, all of this with some public awareness and public education related to them. So I don't want to go too deeply into the specifics, but if car batteries, if lead acid batteries are a key issue in one particular country, this is the stepwise process that one goes through. And I suggest that if you are a person responsible for these exposures in your country, that you contact the Global Alliance, and we can begin a process of going through, helping you go through these steps the economic incentives of looking at GST reductions and benefits from improved, actually increased levels of GST recovery, to looking at surcharges and green surpluses that can go on, and then all of the other aspects that need to happen. They're well-trodden kind of processes that we can help you with if this is what you're responsible for. And again, spices, as we talked about, it's mostly about supply chain tracking. You want to look to see where is the lead being added to the spice. What we find with turmeric, for example, the farmers who are growing turmeric, these are small tubules, small little potato-like things in the ground. When they're pulled out and they're dried on plastic sheets in the sun, they turn that lovely turmeric yellow-orange color. But if the farmer is in a hurry, or if there's some rain or bad weather, and they don't get a chance to fully dry, when they're being ground up, then whoever's doing the grinding will add lead chromate into the mix at that time, so that the product ends up looking the way they want it. And so finding out who's doing that and where, and giving an alternate colorant. We should make sure people can get access to safe colorants to do this same thing without poisoning the entire economy. So these are processes that are kind of self-evident and obvious once one thinks through it. By the way, we've started this process at Pure Earth in Georgia, in Bangladesh, in India, and we want to do more of this as time goes on.
Thank you, Richard. I think we're over time. That's a very, very important issue. Thank you. Pratana, could we ask you to talk about what Clean Air Asia is doing?
Thank you. So I'm going to talk about a case study because I thought it would be interesting to understand the policy interventions that we are making through a case study. So primarily we work in supporting cities with clean air action plans. And what you see is a program that we are doing in 2 cities. It's called the Asia Blue Skies program. And it's basically based on how you can make data accessible and assist the government in clean air action planning, so that there's also a component of communicating this data to people so that the public is also engaged. So we started in Manila, which had practically zero monitoring in terms of data on air quality. We started by supporting the government by putting up three sensors and generating data. And just to make the controversy of using sensors less, we also tried to kind of look at it by comparing it with a reference station. So there was a single reference station in Manila, and calibrate it so the data could be used by the government in terms of using it for public engagement. And the result was that between January and July 2020, we could actually communicate this kind of data within the lockdown to people so that they are conscious about the PM 2.5 levels. So we had data for 3 locations, and we also had a comparative so people could see it. And this is a communication platform that we've developed within the city. The other knowledge-based development that we supported the city with is on the emissions inventory, which is basically looking at what are the point sources for CO2 emissions. And this is the kind of data that we've generated over the past 7 or 8 months. And this is primarily being used in policy planning by the Manila city government. We also looked at area sources, where you can see this is actually methane emissions, and we mapped it with the population. We've also looked at it in terms of 10 administrative districts, in terms of whether it's a commercial source that is emitting the methane or the residential areas that is emitting methane. The third area that we've been supporting the government is in capacity building. So not just doing the data collection, was also teaching the government officials in terms of monitoring and how to interpret data, looking at communicating this with people and how do you use it for policy interventions. And as I showed you, the introduction to the development of the emissions inventory, and then we're now going into health and pollution source mapping. And finally, it ends with the Clean Air Action Plan. So that's Manila for you. And I just want to illustrate another approach because cities are different as far as their air quality management status is. So then the other city that we are working on the same program is in Delhi. And if you look at the slide, there are 6 guidance areas, which we just followed, as you may have seen in the previous slides. So we looked at monitoring, we looked at emissions inventories, health impact assessment, air quality communication, clean air action plan, and governance. Now, if you look at Delhi, Delhi is primarily in a good situation compared to Manila. Manila just had 1 station. Delhi has 49 monitoring stations. So data is not an issue here. Similarly, there are detailed studies and there are about 24 studies on health impact assessment. There are 30 organizations working on communication. And yet, every winter we are worried about the air pollution. So what we've started with is trying to create a new baseline for Delhi. This is the Delhi lockdown diary. So if you see for a city that has never had better air, I mean, the average AQI in Delhi is usually poor to moderate, but we actually see within the lockdown that we have so many green lines and even an AQI, which is much better than the WHO prescribed guidelines. Similarly, for other key pollutants, you can see the variations of 2019 and 2020. You can see all the key, and this is all data that we've looked at during the lockdown in terms of the existing data. So our approach in Delhi has been slightly different. The government identified 13 hotspots, and these hotspots are localities within the city. And what we have done is we have assessed these hotspots in terms of looking at sources within these area hotspots. And this is where I think it's important. I wanted to share it in this forum is because we're also doing vulnerability assessment within these areas. For instance, we have selected 3 residential hotspots where we are looking at the sources within that area, the vulnerable communities which are impacted within that area, and engaging people within that area to get involved in action within that area. So this is an assessment in terms of, I'm just showing you how we are engaging people. So what we started with when we did with each hotspot is that we went through a public perception survey, talking to people in terms of what they think is the major source of air pollution within that area. And as you can see, this is an area, this is called Arkipuram. It's an area primarily residential with almost 13 sectors. Each of these sectors have about 200 households. So it's a large area. And most of the people feel that it is vehicular emissions, which is the major issue. And the idea is that once people understand the problem, how do we get into solutions? The second part was to map it with the existing monitoring data. So as you can see here, it shows that PM 2.5 is the larger criteria pollutant, which is impacting the area. But at the same time, I mean, if you look at transport and vehicular emissions, it's actually NOx that we should be worried about. So is it really vehicular emissions or is it something else is the question that we are trying to ask ourselves now. So the approach has been now is to generate microdata to see whether it is vehicular emissions or another source, and then looking at how we could address it from that perspective. So ultimately, if you look at both the examples that I've given, what we looked at was a clean air action planning model where we look at prioritizing issues and goals by doing firstly an assessment. So if you look at this, the path that we are taking, Manila would probably be in a developing stage while Delhi would be in an emerging stage, so slightly ahead, and the strategy changes accordingly. So the idea is to localize an approach in terms of clean air action planning. The idea is to define the scope and limitations, and finally identify the implementing bodies and how we could actually look at public also to be engaged in the solutions. Thank you. Next.
Thank you, Pratana. So we have a lot of data in front of us and a lot of arguments for why the international community should be really paying attention to pollution. So thank you all for presenting that. How can we prioritize pollution on the national and international levels? What are the roles of the different stakeholders? What do we need to be doing differently? Could I turn it over to Richard to address those points first?
Thank you. Yes, it's very difficult often to bring pollution to the forefront in a government policy because it's often considered an environmental issue. And environment is generally a weak department with inadequate funding. It's not generally considered a health issue, even though it may be the largest health issue in the country, because it's related to prevention rather than treatment. it's often associated with transportation or with agriculture. And often it affects things like tourism. So it becomes very cross-sectoral. We have to recognize that pollution is a cross-sectoral issue and begin to direct attention in a cross-sectoral fashion. That's really the only way to be able to make sure that it becomes an agenda for the executive of a country's decision-making process. The way that we've been working in GAP to do this is we've begun in a dozen countries these processes called Health and Pollution Action Planning. Our nickname for it is HPAP, which is fun 4 letters. What happens with these planning processes is senior representatives from all of ministries involved, not just health and environment, but also transport and planning and finance and tourism, and all of them are brought together to review the substantive issues related to pollution in their country and to prioritize what particular scope of interventions ought to be undertaken. So when we've done this in certain countries, we end up being able to be quite specific in terms of saying what interventions should occur that would save the most lives or produce the most benefit for the economy. So for example, in Thailand, issues related to agricultural burning in the north became obvious as a key issue to deal with. In other countries, it's been related to batteries and lead or burning of other issues and air pollution and other issues. So that planning process seems to be effective in being able to give priority to what is a very broad set of problems out there in each country. In parallel to that, we highly recommend also that there is the same processes going on within the civil sector, who can then provide the right kind of tracking and accountability measurements necessary for governments to implement those solutions. And by the way, we also must acknowledge that it's deeply embedded as a private sector process here, both the creation of pollution and the solution to pollution is deeply, deeply, deeply embedded in the private sector. And so all those sectors need to have active processes underway that have to be coordinated at least at a nominal level in order for real change to occur.
Thank you, Richard. Partana, what should we be doing?
So this is my favorite topic. Yeah. So I think one of the success stories as far as India Cleaner Asia is concerned, and which we would obviously like to extend, is the role of youth in addressing air pollution. As you know, a country like India has about 34% youth, and we've been trying to engage with the youth in terms of engaging them, not just in terms of having campaigns or creating a huge advocacy, but also in the real solutions. So we have youth working in about 7 cities in India, where they have kind of become like a volunteer movement. They are not attached to Cleaner Asia as such, but they've just grown out of Cleaner Asia. And the interesting part is that these are young people from different backgrounds. So there are people from technology who are actually looking at technology solutions, while there are others who are from communications. So they make great films, which is great for us because, you know, the whole drive happens from an extended source, and at the same time, you're able to guide the process of driving, you know, policy through active public engagement. This is a very vocal group, and we started in 2017, and today we are in about 7 cities. But and these are of course, it's a very loose group, so it's not like, you know, they're all the time. It's evolving. I mean, and they grow up. So I think so. This is one of our success stories. But the more important part is that we are trying to integrate the youth program within our city action planning work. So here are a few examples, and I'd like to run you through at least one or two examples. So some of our youth were involved in preparing an app for Indian cities. And we were discussing with them in terms of what could be a better way to engage with people. And it was an idea that came up from the youth that we would look at a pledge component. So what happens now is when you look at the air quality, you also contribute, you decide how you want to contribute to better air quality. So you pledge. And the idea is that we collect data. So if somebody decides that I will walk to school or I will cycle to work, then that data can be collected from within a city, and you can actually have the numbers in terms of how many people want to cycle in a particular city. So that becomes a kind of a force to drive the policy. Similarly, the youth are engaged in micro projects. We have a very interesting project in about five cities where we are monitoring air quality in play areas of schools to basically understand the health exposure in terms of the air pollution levels, and how do we look at addressing the solution. So what the small little picture that you see at the bottom is actually a playground which is just next to a power plant. And till we brought this idea into the forefront, no one was really conscious about the fact that children shouldn't be going out to play at peak hours. So we're monitoring air quality there, and we're trying to engage the community in trying to also define policy, push for policy, better policy within the cities. Similarly, our youth are also involved in something called supporting enforcement. So we have youth monitors who are attached to government offices and are actually looking at monitoring, say, polluting vehicles or burning of garbage, and using social media to create an engagement process. So I think some of the opportunities do look. I mean, we do need to go into innovative solutions, and I think the youth we have a huge opportunity. The other is that it's also a very positive force. So in terms of addressing solutions. So I think it's important to engage as many youth in the whole clean air process. Thank you.
Thank you very much. Dr. Ibtihal, what is the NCD world working on to address these issues?
Thank you very much. I think from the civil society perspective, and specifically NCD community, has contributed heavily to the advocacy agenda for air pollution over recent years, to strengthen the mandate and action on air pollution by head of state and leaders. Some of the results which I want to list, like the recent one, the air pollution and other environmental risk factors have been recognized at the landmark 2018, the UN political declaration, by all head of state and the government agreed and recognized. They moved from the 4x4 agenda, which is the 4 risk factor and 4 diseases, to the more comprehensive agenda 5x5, including air pollution as one of the main risk factors for NCD morbidity and mortality. And this is a great, so far, on the work of the advocacy for that cause. Prior to that, at a global level, these include the WHO roadmap for enhanced global response to the adverse health effect of air pollution, adopted at the 69th World Health Assembly in 2016, and as well as the UN Framework Convention on Climate Change, and in particular, the Paris Agreement. I want to mention also on a regional level, we have through the advocacy work, the WHO Southeast Asia region included a specific target within the WHO 9 voluntary targets, which we know about it, to be achieved by 2025. They included one target related to air pollution. And in this context, I also should perhaps mention that few of the countries in our region, the Eastern Mediterranean region, have also included one target related to air pollution among the 9 voluntary targets. Again, as a global civil society, NCD Alliance working with a different civil society, with the youth group, with the medical society, with the student association, environmental think tank, to show that a quick, cost-effective policy solution are available in different economic contexts at the international level. I want to refer also to the work of the previous speaker mentioned about the importance of showing data and the impact to the policy and decision leader. So the work here of, in this context, the work of the United Nations Interagency Task Force on NCD, they produced many things which is related to that, to support the government to take a policy action, including the investment case on air quality measure. This is a very good document or documentation on how government and policy leader could be convinced on working on air pollution. We have also worked to mobilize the health community, building on a major success story. And we are referring here the tobacco control policy to show that the similar tool which has been implemented in area of tobacco control can be used and mirrored also in area of air pollution. So that this is things which is related to regulating unhealthy commodity, including fossil fuel. In this slide, I can show you some of the NCD Alliance advocacy publication and document, which has been published and available on the NCD Alliance website in relation to advocating for air pollution clear and a solution. So the NCD, one of them is the NCD Alliance report on the international, with the International Institute for Sustainable Development, the report entitled Burning Problem, Inspiring Solution for More Lesson Learned for Air Pollution from Tobacco Control Campaign. And this can be accessed from NCD Alliance website. Having said that, there is still civil society is going to work and will be working with the different partners on a great deal to remain to be worked on. And there is a lot of work to combat this public health emergency of air pollution. In the slide on the left side, you could see this is one of also NCDA publication, which illustrates some action that need to be taken at local, at national, and at regional level to combat air pollution. This action, if well implemented, will be able to have a quick win and will be able to reduce the burden on the population and the premature mortality of NCD as well as the disability. Thank you, and over to you.
Thank you, Dr. Ibtihal. Raymond, what is the role of health and education-based civil society organizations in addressing pollution?
Thank you, Rachel, and thanks to the colleagues for sharing a lot of information in relation to pollution and how to address it. Of course, a lot of health and education-based civil society organizations. One is to advocate for healthcare options, to recognize, diagnose, treat pollution-related diseases. Of course, this can be done through universal health coverage with focus on child health, because a lot of maternal health deaths related to pollution and premature deaths. Secondly is budget allocations to raise awareness of pollution-related disease and interventions. We know the countries in Africa generally, Sub-Saharan Africa specifically, and Uganda in particular, the budget's in relation to addressing pollution issues is donor dependent. But how much does governments allocate domestic financing for addressing pollution? Our concern is governments allocating more funding, domestic funding in their local budgets to address pollution issues. So budget allocations is paramount. So advocacy for it is a prerequisite for us as for organizations working on health and education, but also mainstreaming pollution awareness and intervention strategies into healthcare provision is one of the best avenues need to be aligned, because realized in many countries, pollution is looked at as silo in one end, yet the impact is all sectors. Pollution affects all sectors of life, and then we propose an integrated model to bring pollution interventions in all sectors, be it health, agriculture, in petroleum, in energy. All of these should encompass avenues to mainstream pollution awareness and interventions. But most importantly, capacity building in communities for them to be resilient. The impact of pollution is paramount. Earlier on, Richard mentioned avenues to strengthen addressing lead and other impacts, and our colleagues mentioned earlier. But how are communities resilient to this? So resilience starts with building capacity of communities to hold, most importantly, hold duty bearers accountable to addressing pollution-related interventions. Other than that, pollution would be a thorn in at least developed countries in Africa, Sub-Saharan Africa, and Uganda in particular. But this starts with developing and building capacity. Richard mentioned about doing an health and pollution action plans. We need to compare governments, strengthen them, build the capacity on how to develop those health and pollution action plans for them to align these in their budgets and their programming. Thank you.
Thank you, Raymond. And that also picks up on what Pardana was saying about, we have different communities that are exposed in different ways. And the ability for communities to adapt their exposure risk is absolutely key, as are actions on behalf of the private sector and government. Thank you so much for that. Dr. Cora, what do you think that we ought to be doing different as a global community?
Thank you very much, Rachel. And of course, I agree with the previous speakers. And of course, I think that these things reinforce what they had said already. Of course, from the perspective of Latin America, we understand that we must address pollution to achieve sustainable development goals, that not polluting is inherent in the notion of sustainability itself. And of course, the pollution has important implications in at least 11 sustainable development goals, like economy, climate change, environment, health, gender and biodiversity, livable cities, and spillover effects such as pollution, refugees, conflict, national security, and geopolitical challenges. There is a high cost of inaction, and to tackle pollution, so this is destabilizing sustainable development process, and the more vulnerable are, of course, in harm's way. So what we think we have to focus is in three main issues, that is communication, education, and change behavior. So we have to change the way we are communicating. We must engage everyone. So we have to democratize the information, not only to access the communities and the workers and the individuals and professionals, but also the decision makers in the different countries, because sometimes we have to reinforce the message addressed to the decision makers. We have to change the way we are educating. Of course, environmental matters and health effects are a cross-cutting issue and must be incorporated at all levels of education, primary school to university. We have to change the curricula at the university. We have to have professionals that understand how environmental issues and environmental health issues and sustainable development is in the 21st century. And we have to change the way we are acting. We have to change behaviors. We have to include all the relevant sectors. We need private sector. We need them to initiate actions, voluntary actions. And we must build back better. We have to take the chance of this opportunity to build back better and leave no one behind. Thank you very much for this opportunity.
Thank you, Dr. Cora. And indeed, thank you to all the panelists on here. I mean, we're really seeing that by poisoning the air that we breathe and contaminating the water that we drink and the food that has contaminants in it. You know, it's really, pollution is really threatening the health and well-being of humans and in fact our entire planet. We're seeing that pollution is contributing to land degradation and food insecurity, climate change, a loss of biodiversity. And as Richard pointed out correctly, it's not just an environmental problem, it really is a health problem. It's a biodiversity problem, it's an economic growth problem, all related to all of those sustainable development goals. And if we don't address it, it really will continue to hinder our growth, hinder our ability to thrive on this planet with a biodiverse ecosystems that provide all sorts of service to us. It will inhibit the ability of our youth and future generations from really achieving their full potential. We see that in particular with lead poisoning, but with all of these other things. And it's also contributing to fragility and instability. And we need to help communities be empowered to take choices that will enhance their resilience to pollution, their ability to reduce their exposures, but also the ability for those communities and the actors in society, from civil society, from academia, to really access the data and the arguments to convince policymakers that we really do need to act. And I think despite all of this kind of depressing news about how big the problem is, there is a light at the end of the tunnel, right? The good news is that pollution is solvable, it is preventable, and there are many actors who are working very hard to implement those solutions and actions. And the other thing that is positive out of this, with regards to pollution, is that when we start acting, we can see the health benefits and the environmental benefits right away. I mean, the COVID crisis, unfortunately, had a huge impact on human health, and economies were shut down to prevent people from dying from this. And kind of that silver lining in a very horrible way was that we're seeing blue skies for the first time in generations. So what we are showing of the positive takeaways from this is that when we act together, we really can have an impact, and we can prevent the pollution from harming the planet, from harming human health, and those sort of things. So despite all the bad news, we really can solve this problem. We can solve it in our lifetimes. And there are many actors out there who are working on this and happy to provide technical expertise and advice on how your organization could get involved in this area. So I would really like to thank everyone here on the panel today for being here. Thank you very much to the C20 Secretariat for allowing us to present to these important issues to the audience. I would love to open up the floor for questions from the audience or from the panelists to each other. Okay, I'm not seeing any questions from the audience. I guess you are all just absolutely astounded, but we are here to answer questions later. You can visit any of our websites. The Global Alliance on Health and Pollution is www.gahp.net, Pure Earth, pureearth.org, and NCD Alliance, NCDA Alliance, I think, .org. So we look forward to engaging with you in the future to solve pollution and health problems globally. Thank you so much, everyone.